Welcome to A Shot in the Arm podcast. I'm your host, Ben Plumley, and this is a podcast about innovation, equity, and global health. It's the end of May, so we must be in Geneva, and indeed we are for the World Health Assembly. The World Health Assembly, of course, is the decision-making body of the World Health Organization and all of its member states, its governments and delegations, and we have a sprinkling of NGOs, a sprinkling of businesses, and a lot of commentators. As you know, A Shot in the Arm is going to be podcasting daily on what we're hearing, both on the floor and off the floor, inside conversations and side events, which frankly is probably where most of the business takes place. It's going to be a momentous week. There's a lot happening. But it's also a momentous week for A Shot in the Arm, because Yvette, Raphael and I are going to be joined by a new host. Now, he's a friend of the pod. He's been there, done that. He's held senior roles in pharmaceutical companies, in non-governmental organizations, public relations agencies. He has an encyclopedic knowledge base, and he has a very dry, shaken not stirred sense of humor. It's Jeff Sturchio. Jeff, welcome to the family. Welcome to A Shot in the Arm.
Well, thanks, Ben. Thanks for that warm welcome. And I'm looking forward to joining you and Yvette and seeing if we can shed some light on some of the important issues that are before us.
Well, thanks. And Yvette sends her apologies. She's in Jozi, Johannesburg, South Africa, couldn't get up here. So we got a lot on with the World Health Assembly. What are the list of things that you're focused on and think we should be paying attention to this week?
Well, as always, the World Health Assembly has an ambitious and expansive agenda, and they rarely get through everything. This year is going to be no different. They have to cover things that range from air pollution to zoonotic spillover. And it's just a vast number of different topics, each of which is absolutely critical to some constituency around the world. And so in that sense, it's going to be a real potpourri of a wide range of issues and challenges. But I think there are really two major issues that'll be before WHO this week that it'll be worth looking for some progress on. The first is the pandemic accord, and we'll come back to that in some detail, I think.
Oh, hell yes.
Yeah. The second is WHO's investment round. And just briefly, what the idea is that in January, the WHO launched this plan to have an investment round, which is their way of framing their request for $7.1 billion for the WHO's budget over the next 5 years. And the challenge there is that governments are pretty happy with the amount of money they've been giving to WHO, which is fairly modest in the grand scheme of things. It will be a challenge, and we can get into this some more later in the conversation, because there's going to be a real traffic jam of replenishments for global health institutions over the next 18 months. And they're just taking their place in the queue, hoping to get a large amount of new money from donor governments largely who have already have the attitude, well, we gave it the office. So it'll be interesting to see how things turn out.
Thinking about the atmosphere here in Geneva, I'm sensing quite a strong degree of exhaustion. Perhaps that's not so surprising given that the global health community has been at the forefront of the COVID response. Resignation and maybe a bit of depression about how the state of the world is with these deepening geopolitical crises and tensions. And it's almost like we're spoiled for choice with crises.
Yeah. Well, it's an interesting way of putting it. But I think the answer to that question is yes and no. I mean, it depends on who you ask and where you, whose pulse you're trying to take at any given time. On the way up here, we're sitting in the UNAIDS WHO office building on Via Appia in Geneva. And on the way here from downtown, I was on the bus because it's an easy way to get around Geneva. And as I was sitting there, I just overheard this conversation among, half a dozen or 10, 20-somethings who were working for different NGOs. And they were they were just extremely excited and enthusiastic about being in Geneva during the World Health Assembly. I heard some of them say it's the first time they'd been to Geneva, and they'd been working for their NGO for a couple of years. And of course, this is an opportunity to meet all kinds of constituencies, to network, to, pitch what their group is doing and trying to make a difference in global health. So there's enthusiasm among some people who are here. On the other hand, if you talk to the diplomats who've been trying over the last month to bring the pandemic accord across the finish line, they're probably exhausted, frustrated, fed up, and just wish that they could figure out a way for this to make this go away.
Yeah.
Yes, in that sense, there's going to be a lot of frustration and exhaustion. Things will vary on that spectrum from, a sense of optimism and enthusiasm to a sense of kind of despair and pessimism that things are going to hell in a handbasket.
Two things strike me. The first is, of course, that back in the 90s, you and I taking the number 8 bus up to the WHO and the UNAIDS office, we would have been those enthusiastic, bright young things, or maybe not so bright in my case.
And not so young in mine.
But it's a reminder that, we do need new blood, new energy coming in. The second thing is, you've been a little naughty because although, yes, we are in the UNAIDS WHO building, we are being hosted by UNAIDS in one of their conference room, the Suman Mehta conference room. Suman was a dear friend and colleague of ours back in the day, and she passed in the, mid to late 2000s. So, yeah, it's great to be here at UNAIDS. Okay, so let's get to the elephant in the room, the pandemic treaty or the pandemics accord. And thinking of that absolutely brilliant New York Times article that was written at the end of last week around how we're not going to have a treaty signed this week. Where are we? What's going on?
Well, it's interesting. If you read the text, which is probably the worst kept secret in Geneva right now, it hasn't been publicly released, but everybody I know has seen it, and that's the negotiating text that, at least as of Friday, was the last document that we had seen. There are many things on which everybody agrees, but there are just a few issues on which nobody agrees. And that's why there isn't going to be a signed accord at WHA this year. Now, partly the challenge has been that if only the International Negotiating Body, which was the group that was set up to host and conduct these negotiations, had been able to focus more on the areas where there was agreement, they might have been able to come to consensus around those areas and actually have had something to sign.
But it begs the question then, Jeff, if we're in a state where people will be able to agree things that they can agree on, the things that really matter are the things that they can't agree on, right? And so what's the point of having a treaty that doesn't do what it needs to do?
Well, that's one way of looking at it. But if there were an accord that everybody, that all of the nations that were involved could agree that they would sign and put their reputations and resources behind, that would be a huge step forward. Because then at least we wouldn't have had the shambolic response we had to the COVID-19 pandemic a couple of years ago. What worries me is right now, and you've probably been following this too, there's a growing H5N1 epidemic around the world. There have actually been a few instances of human infection in the U.S. at least. I haven't been...
That we're aware of.
Yeah, that exactly. And, for those of us who've, it's like I've seen this movie before. And, in a couple of months, in 6 months, it could be that it's going to be much worse, but nobody's paying attention to that right now, despite the fact that the CDC and other public health agencies are beginning to sound the alarm.
But isn't that even all the more reason for shifting this upper level? How can we expect the WHO, which is made up of ministers of health, and you and I have said that, if we're being brutal about it, ministers of health are fairly low on the pecking order in government. Why are we leaving it to the WHO to negotiate something that is so fundamental to economic and social stability?
Yeah, well, I can only imagine it probably would have been more contentious and less possible to get it over the finish line had this been done in New York rather than Geneva. By that I mean had it been taken up by the diplomats at the United Nations in New York who address all those other issues and not just the health issues. But of course, I mean, another argument for having it at WHO is that the health dimensions of global pandemics are absolutely critical to succeeding at containing them. And then if you contain pandemics, you have all kinds of social, economic, and political benefits that eluded us in the COVID-19 pandemic. But I want to come back to the point, the question you asked before about, when I was suggesting that if we had only focused on the things people could agree upon, that having that instrument in force would have been a step forward. Because the things that people can't agree on, and it's a short list, but it's the same list that's been around forever. For instance, they've been having big arguments over what's known as the pathogen access and benefit sharing provisions in the Accord. And briefly, succinctly put, it's that countries in which new pandemic in which new pathogens emerge feel rightly that partly this is a genetic resource and something that is theirs. They feel a sense of ownership. And want to be sure that if they share data about these emerging pathogens, their genetic sequences, and the information about early incidents and the surveillance of how they spread, that information, which will be critical to a full and systematic global response, is something for which they should be compensated. And the way in which they want to be compensated, that's the benefit sharing part, is, if that information is used to develop countermeasures like vaccines and treatments and diagnostics, they want to make sure that they have complete access and ready access to those VTDs, as they're known, vaccines, treatments, and diagnostics, and not have to be begging for access to them the way they felt they were with the COVID-19 vaccines when those came along.
But you could look at it as, not only do they have a right to have that information, the countries where these pathogens are emerging, very often, not exclusively, are countries that maybe don't have the resources to be able to mount the kind of responses that are needed, certainly as it relates to the researchers and the developers of vaccines and medications. So there's also not only a need to have some benefit derived from this, but also saying, don't put us to the back of the queue like you did with COVID.
Yeah, no, those are all reasonable questions. And the problem is that they get obscured when what happens then is that these arguments are linked to questions around intellectual property, around technology transfer. These are all other issues still in contention in the pandemic accord. And the result is that you just have stasis, that nothing new happens. And the countries who were left behind in COVID-19 are going to be at risk of being left behind when the next pandemic comes along. And my argument would be that instead of getting stuck on these negotiations around difficult issues, part of the reason that people are stuck is that the people having these negotiations don't know enough about the issues to actually come up with creative solutions that will help ensure that everybody's interests are covered.
So 2 things about that, Jeff. I completely agree with you. That perhaps speaks to my point about taking it upstairs and bringing the experts in, because this is also trade policy, and that's where the US, the EU, and I have to say with great regret that the UK does not sit in the EU, but anyway, but these are countries that are saying, no, we need to protect our R&D industries. Yeah. But the other thing is that unless we deal with these Gordian knots, we're not going to be able to protect ourselves adequately for the next pandemic. We actually really lucked out with COVID-19. It turns out it's not particularly brilliant at transmitting. Okay, it's respiratory, but it hasn't caused the kind of mortality that if we don't get things right with H5N1, that could potentially do. So does it not speak to really getting, yes, the right people in the room, but really paying attention to these issues, because you and I have been part of a movement that has made some progress in dealing with IP and access issues. And of course, I'm talking about the HIV treatment movement that both you and I were in the late 90s and beyond. And it just seems like we're back to the future, that we haven't learned anything. And why is it, do you think, that people are not looking at the experience of HIV access to treatment in particularly the early 2000s and beyond?
Well, partly it's because each new disease has its own constituency, and so they're interested in what they're interested in now, and institutional memories and these issues are not what they might be. The other is that as you said before, we're sort of and it was odd to use this expression, but we're spoiled for choice on the kinds of crises that are ahead of us. Now everybody's seized with the need to do things about climate and health because of the advancing global temperatures. Look at migration. There are now more than 110 million people who are either internally displaced or refugees, more than any time in history. There are probably close to 400 million people who've been affected by humanitarian disasters and need assistance. And that challenge is one that, just look at what's going on in Gaza right now, that the global community hasn't figured out how to deal with that. And that's only the most egregious of those challenges. In fact, an interesting factoid about migration and internal displacement is that more than half of that 110 million people come from just 3 countries. And those are Afghanistan, Ukraine, and Syria. Ukraine is another recent example of what happens with conflict and the impact that it has on health and society. We've got pandemic threats. We've talked about that. H5N1, not to mention COVID-19, is not over.
Right.
And we've got the challenges of long COVID. We have aging populations. And then we just have the global geopolitical tensions, which are likely to get worse before they get better, not least because there's something like 60 elections that are coming about in countries all over the world in the next year. And I live in a country, the United States, that is now trying to figure out what it's going to do with its election coming up. The UK, where you're from, Rishi Sunak just called for an election, so they're going to go
in the rain.
Yes, that's true. And there are probably there are literally dozens of other countries that are going to face that, and with some uncertain prospects for how that will turn out in certain countries. So when you add all of that up, that may be why people don't just sit and think, well, maybe we should think about what happened 30 years ago when the AIDS epidemic hit, and what can we learn from that? But you're absolutely right, because now, like for instance, on these questions about benefit sharing and technology transfer and intellectual property protection, we've worked all that out in HIV/AIDS. And those who said that if there were any shift in standards in the rules of intellectual property protection, the sky would fall. But the Doha Declaration came and was put into place. The TRIPS Amendment in 2005 was put into place. The sky didn't fall, and more people kept getting access. But partly that's because we also understood in the work that was going on around HIV that it was important to find ways to work with the private sector, not see them as implacable adversaries of civil society and the public sector. And so it was possible to work out ways in which you could have licensing agreements that would make it possible to have more generic companies come in. You were able to create sustainable marketplaces in HIV therapy. So the result is now that we've got I think the last statistics are that about 75% of the people who are HIV positive now have access to treatment, when it was essentially in lower and middle income countries. When we got started 24 years ago, it was zero.
Right. And which brings us on to a side observation that the international community is celebrating 10 years of dolutegravir access, and over 1 billion doses of dolutegravir being made available in low and middle income countries. So we've sort of got the evidence that we can do it. And I know we're going to spend a lot of time talking about the pandemics treaty, both in the podcasts this week, but it's something that you're going to cover, particularly in future episodes of A Shot in the Arm podcast. Let's go back, if we may, to the replenishment, dare I call it that, of the WHO. So how much are they seeking to raise?
$7.1 billion.
How much have they raised?
At least according to the press release that was issued yesterday, $4 million.
So that's how much to generate for the next 5 years?
Well, one way of looking at it is they only need, and it was Qatar at the launch of the investment round who made this pledge of $4 million, which, it's great. Every little bit helps. But at that rate, they need another 1,775 pledges of that size to reach $7.1 billion. So they're, let's see if that happens. The challenge is that, WHO has a problem in that as I said before, they have to face everything from A to Z in global health and deal with it. The world expects much from WHO, but have never funded WHO at the level in which it would be possible to deal with all of those issues adequately. So obviously you have to have some priority setting. You have to be very careful about resource allocation. But then WHO has the added challenge that only about 13% of their funds come from the assessed contributions, which each member of the World Health Assembly, each nation that is assessed a certain amount based on their I believe it's gross national income. And those assessed contributions in a perfect world would add up to all the money WHO needs to do everything it has to do. But it's only about 1 out of every 13%. So that's about 1/7 of what they need comes from those assessed contributions. The other contributions are voluntary contributions, so-called, from other nation states, but those comes with strings attached. The Netherlands might agree to give WHO a certain amount of money for its work on access to medicines, but then they also say, well, we want that work to be done in a certain way. And it's not surprising that they also check to see that the money was used the way that they wanted it to be used. So when you multiply that across the billions of dollars that WHO has in voluntary contributions, what you have is a situation where they have, instead of what they would like to have, they have unpredictable funding. It's tied to specific projects or outcomes. And it's just not adequate to the challenges that they face. So what the goal of the investment round is really to try to get them to where they'll have predictable funding and flexible funding so that they can deal with the kinds of not only do they have this wide range of issues, but they're responsible for addressing health emergencies. Well, in 2022, there were 70 declared global health emergencies that WHO had to try to manage. So if you don't know at the beginning of the year that you're going to have 70 crises come up and you have this inflexible funding, it's hard to do what you need to do.
I mean, at the 38,000-foot level, I think it comes back to the fact that the world is not collectively committed to investing in health. We don't really see it as a fundamental strategic human rights, economic and social priority. And that's really going to come back and bite us in this new era of multiple challenges. So, I mean, I think the investment round is really important.
Yeah.
And we have to find ways of all of us persuading our governments that the old way of doing business in supporting WHO really is not fit for purpose. Not the organization, the funding model.
Yeah, no, I would agree with that. And the other thing about the way that things have been funded is that it's reactive, not prospective. That instead of thinking what should our strategy be and let's make sure that resources are allocated to that, you're always just constantly passing the hat around when some new crisis comes up. So to WHO's credit, they're also they've prepared a new global program of work, or GPW, which outlines a set of very clear strategies for what they want to do in the next 5 years, from 2025 to 2028, I guess. And they base that on the 13th GPW, or Global Program of Work, which laid out this 3 billion strategy, which was to try to ensure that 1 billion more people have improved health and well-being. 1 billion more people are covered under universal health coverage for both health services and financial protection against catastrophic illness, and that 1 billion more people were protected from health emergencies. So, and WHO, again, to its credit, has issued a report card on how well they did on the 13th
And how well
GPW.
did they do on it?
I mean, I thought you'd never ask. So they've reported that they reached 1.23 billion improved health and well-being, but they're less than 50% of the way towards universal health coverage, incremental increase in universal health coverage, and only about 70% of the way toward health emergencies. So that's creditable. It's much better than the Sustainable Development Goals, which is something else we could talk about, which are only about 15% on track, and about half of them are off track. But now, so WHO is saying that if we're actually going to carry through on the 3 billions and really get to where we need to go on universal health coverage and primary health care and pandemic protection and the other major priorities, including understanding, getting to the root causes of health determinants, which means not only dealing with health issues, but also with food insecurity, with environmental protection, with,
climate health.
Exactly. Yeah. All the things that go into whether people can live, have access to a healthy life, and that applies to everyone, so that there's equity, health equity as well. WHO is making this argument that we need $7.1 billion. But when I talked about a traffic jam of replenishments, just to place this in context, in the next 18 months or so, the pandemic fund is going to be asking for more money. They had asked for $10 billion a year. So far, they have $2 billion. So they have a gap in funding as well.
And that's what the World Bank manages, is
That's
it?
right. That's right.
Yeah.
And Gavi is going to have a replenishment. The Global Fund will have a replenishment at the end of next year. The World Bank, International Development Association is going to have a replenishment. People are looking for money for the Global Polio Eradication Initiative, for the Global Financing Facility for Women's and Children's Health. And coming back to climate change, there was just a big powwow in Dubai, the COP28, I think the number was, where there was a lot of discussion about how are we going to fund the loss and damage fund for developing countries that want help in dealing with the impact of climate change, which has been caused largely by polluters in the global north. So all of those replenishments and funds are on the agenda for the same set of donors. So part of what the WHO wants to do in their investment round is tap countries that have not yet made voluntary contributions to the WHO. You have to be a huge optimist to think that they're going to get much from that, because if they were going to make contributions to the WHO,
surely they would have done so already.
That's right. They've had 75 years to plan to do that. And then they're also hoping to get significant private sector resources through the WHO Foundation.
Well, and we've got a lot of expectation riding on Anil Soni, the CEO of the foundation, and his development director, Valerie Boulay. Jeff, it does come back to the need for us at A Shot in the Arm to be really laser focused on how to get innovation and equity in global health onto the right political agenda. Mm-hmm. By the right political agenda, I mean that it has to be one of our core strategies. And I think you're more optimistic than I am just at the moment. I feel that this sort of growing atomization, nationalism of politics, the collapse of some of the elements of the global order that, many in the HIV field, of course, didn't like, but which actually created one, global financial mechanism. All of this is sort of coming apart slightly. And I think we've really got to try and show to the world where we can make improvements and where we can express solidarity that will result in improved care for our brothers and sisters.
Yeah, no, I think that, I can see that there are reasons for some people to be pessimistic, but I think you have to be an optimist in this business because the challenges we face are so daunting. But they really affect the lives of literally billions of people. So we've got to find solutions that are going to deliver what we know will work to the people who don't yet have access to those solutions. And I think that we were able to find a way. If you think back 20 some years ago when we were working on HIV and spent a lot of time here in Geneva on those issues, we were able to find ways to bridge what seemed to be completely unbridgeable gaps between the public sector and the private sector. Civil society, the whole AIDS advocacy community was up in arms about the fact that these new AIDS medicines were too expensive and they weren't reaching the people who needed them. But we found ways to make that happen. So I think now we face a different set of challenges, but many of the underlying problems are still the same, and the underlying issues are still the same. I mean, what it all comes down to, in a sense, is money and power. And that's actually one reason why everybody comes to Geneva for the World Health Assembly, because if you're interested in global health issues, it's like the Super Bowl of global health. And all of the aspects of money and power in the global community that have an interest in health come together. Now, will we find a way to make sure that we can mediate all the different interests that are contending? We have to, and we've done it before. And one of the other things that, again, it's just fascinating. The World Health Assembly ostensibly is a place where Vanuatu, a small island nation in the middle of the Pacific, has exactly the same rights and voice as the United States or China. Now, at least through the Constitution, it's one nation, one vote, or one World Health Assembly member,
Same
one vote.
Same for the UN General Assembly.
Yeah.
It should be very humbling, right?
Yeah, but on the other hand, we still find ways not to come to make decisions that seem evidently sensible on the face of them. But that's because of these contentious issues around money and power.
Oh, it's so funny, Jeff, because I was going to cut you off before you started talking about Vanuatu, because what a wonderful way to wrap up this podcast with a call to arms and a call to optimism. These are things that we are going to be covering extensively in the coming months. And, bringing it back to HIV for a moment, at the International AIDS or the World AIDS Conference in Munich in July. But I just want to thank you for giving us such a clear, evidence-oriented sense of what we should be looking out for this week. And again, welcoming you to the team.
Well, I'm looking forward to it. Thank you.
Well, that's it for this episode. Hope you enjoyed it. You can, of course, find all of our episodes on whatever podcast platform you prefer. You can find us on Spotify, YouTube, and LinkedIn in particular. We're going to be podcasting daily from the World Health Assembly, and we'll see what happens tomorrow on Tuesday, the 28th of May, 2024. So that's us signing out on Monday, the 27th of May, 21 years after President George W. Bush signed the PEPFAR legislation. Have a great day and a safe day, everybody.